Much looking forward to this session, and we switched a little bit the program, and Sam Ward will start our session and speak about the oncosexology situation in Belgium. Sam.
Thank you, Marielle, for passing the floor to me. As you know, Belgium is a complicated country because we have three parts in Belgium. We have a Dutch part, we have a French part, and then we also have a small German part. And that complicates sometimes the organization, even in healthcare. The slides have been made. It is really a joint effort of Crystal and me, but Crystal couldn't be present here today due to personal stuff. You already know me. Crystal is a sexologist and a relation therapist. She works in a very big hospital in Hasselt. Hasselt is a huge hospital in the east of Belgium, and they have a urologist that does the most penile implants in the whole of Europe. And she's also the author of a book that will be released in January 2024 that is called Cancer in the Bedroom. It is in Dutch, but maybe there will be some translations afterwards, but she can talk about it. So, on a national perspective, there is, like I told you, no uniformity yet. Oncosexologists have not yet regrouped themselves in Belgium in an association. What is known is that in all hospitals it is mandatory to have an oncopsychologist who offers free guidance after a diagnosis of cancer and also during the treatments. And sometimes we have the luck of having a psychologist that also has been trained in sexology, but that is definitely not always the case. And some hospitals that are more open to sexual health and the importance of sexual health, they have registered sexologists into the hospital, but it's really not the main situation in Belgium. So only a limited number of hospitals have sexologists, trained sexologists in their hospital. There is a huge foundation for the fight against cancer. In Belgium they get a lot of donations and charity, and they have created a brochure about cancer and intimacy / sexuality, and that exists in the three languages. They also create other brochures specifically to every cancer, and this is a private foundation. It has nothing to do with the hospitals, but they really collaborate with the hospitals, so we really appreciate all their help with cancer care in Belgium. On the Flanders fields, like the UK would say, there is a large-scale research of another foundation against cancer that really wants to open up the discussion about sexuality. And they performed some research, and they saw that barely 1 in 4 participants through the survey received information about the possible consequences of their therapy for their sexuality. So we're talking about cancer diagnostic, then we're talking about cancer treatment, and we often talk about the consequences of the cancer, but we don't always talk about the consequences of the treatment on sexuality. And less than half of the patients who filled in had a conversation about their personal questions and problems related to sexuality and intimacy with their healthcare practitioner. This conversation, sadly, usually took place at the request of the patient. So some healthcare professionals don't open the discussion, but we all know that, and the survey really showed what we already know. So recommendations of the foundations is a call for healthcare providers to proactively discuss the possible impact on sexuality and intimacy before the start of the treatment. It's so important. They should also keep asking about this repeatedly during the care away and the treatment of the patients. And they really advocate that sexuality and intimacy becomes negotiable and becomes really mandatory to talk about it in the basic training of healthcare providers. And we're happy to see that recommendation because this has been the work of Working Group 3, creating a basic curriculum for all healthcare providers. So we're really happy for that. There is another society also in the Dutch-speaking part, which is called SENSOA, and they are really focused on prevention of IST, sexual transmitted disease. And they developed a communication method, a face-to-face method to be able to talk with the patient. And you can see it here, it's called in Dutch, under 4 eyes, 4 eyes. So it's a face-to-face system, and we help healthcare providers using that to talk about the difficult issues. Another, also Flemish Dutch initiative is a working group about cancer care in the gynecologic department. Hilde Toelen has been for the past 3 years, he created a multidisciplinary group about vaginal cancer care. You know that often there is a stenosis of the vagina, a closing of the vagina with a lot of treatments, sadly. And she created the vaginal dilatation group, and they talk about that and exchange best practices. They made different brochures about it, how to use a dilator, what can I do after radiotherapy of the pelvic floor, what can I expect, etc., etc. Then we have some private initiatives, smaller initiatives of institutes that were funded by a charity, probably by women or men that themselves had cancer and provided some money to cancer care. So the Cedric Heil Institute is one of those institutes, and they try to create appropriate training for healthcare providers working in oncology. They provided 2 courses, sexuality during and after cancer care, and they also did a train-the-trainer course, which was really interesting. On the French side, there is, of course, the same interest, but there is much less work. It's always a huge discussion in Belgium between French and Dutch side. We're not going to talk about politics. So there are also French initiatives, but much, much less. So we can find, like in the Flemish side, a broad curriculum in sexology, but nothing specially related to cancer care. What we do find is quite a lot of private groups, like NGO or NPO, that provide courses for a small fee. I don't think it's really a business thing, because they ask really small fees, like 15 euro or 30 euro for a total day course. So it's not a business, but you can see that for the amount of effort they put in, you pay a small amount of money. So this is one of the first French initiatives called Sexo Positive, talk positive about sexual health and sexual health issues. There you can have a 9-hour course during 3 months, and it costs 39 euro, and it's made especially for healthcare providers. Another initiative where for 90 euro you can have 1 day of training related to cancer and sexual health issues during cancer care. And you can see the next date is the 13th of November, and you can subscribe. It takes 1 day for 90 euro. It's not that expensive. On more private initiatives, I made a presentation with Crystal. Crystal has a lot of initiatives in her hospital. She does a lot of training with nurses from the different departments, and she also has 2 evaluation moments a year to see how the training impacted the daily work. At my hospital, we take the time during the urology week to talk about sexual health, and of course it is more dedicated to the urological cancers, because I'm myself a urologist, and it's true that we should make this broader. But since I arrived, we have 2 sexologists in the hospital, and they both speak French and Dutch, so we're getting there, it takes time. So we received from Ilanik a long questionnaire of the things we should answer. So as a conclusion, well, there are no specific guidelines in Belgium, not on one side or the other. There is no social net. There are a lot of local initiatives which are good, but there is no social net of what you can find. For education, yes, you can find education, but most of the time it's not free, and there is no official accreditation or certification after you follow a course. Information, luckily you can find a lot of information on the websites, on university websites, but also on hospital website. There is more and more information. It's a start. And research, there is a lot of research. Well, we have Alexis Domade from the University of Ghent, who is here, and we also have a representative of the University of Leuven. So there is research within the university that is either funded by the Belgian government, or what happens more and more, you can get grants by private foundations, which happens quite a lot. If you have any questions, please send us an email or ask them right away. And yeah, so in Belgium, it just started. We're on the way, but we're definitely not there yet. Thank you for listening.
I think we have time for some questions here. I have a question. When you are having a professional who takes care of the sexology counseling, doesn't that prevent, I mean, the ordinary nurse, the ordinary doctor to take this subject up with the patient? Isn't that a risk?
Well, it's
they can always say,
a good
it's
question.
not my business, it's someone else who has to take care of it.
It's a very good question, but it is, I think, it is the story of the chicken and the egg. Where should we start? Because the healthcare provider can't do it because of his training, luckily we find someone else who is a sexologist. But of course, you're right, it should be the basic training, and that was one of the main efforts of ESMN, and I think we made a very beautiful curriculum under the leadership of Johannes Spitzer. So we're going to use that and we're going to disseminate that. It should be at least the basic in standard care for every, not only medical specialist, but also for the GP. And we should work towards that. That's really a big effort. Yeah. Yes.
Thank you. Thank you very much.
I can repeat the question if you, so that we can record.
So, you know, when you are seeing the cancer survivors, and they are like post-chemotherapy, post-radiotherapy, post-surgery, some are young, some are old. How do you time it that they are ready to talk about their sexual function and their sexual health after that? Because some of them might say, well, it's not the time now, we're happy, we survived cancer, we don't care about the sexual health. So how you bring this demand to allow woman or the man or the couple or the family to demand this service and feel comfortable about receiving the service and complying with the treatment?
Okay, so the question is, when you have patients, either younger or older, after they have followed chemotherapy, radiotherapy, or any surgical treatment or medication, how do you initiate the conversation with them about sexual health? I think the first answer is, it is already too late. We should initiate the conversation before any treatment at the diagnosis. But what you say is true. A lot of patients in the beginning focus on the survival. And they say, you know, don't talk about the erection, you know, I really want to survive.
Exactly.
Okay, if that is their choice, then why not? But you let them know that you're open to the conversation. Especially in urology, we have a lot of patients focusing on the PSA. I don't know if you know PSA, it's a value after cancer treatment, and it should be 0. So that is their main focus. If my PSA is 0, I'm happy. But I am incontinent and I have no erection and I survive, but I'm happy because my PSA is 0. So I think the question was really good. We should talk about it before the treatment. We should do whatever is possible to spare the function of the organs. So try to do preventive treatments to keep the sexual function. And if not, we should always let them know during the treatment, after treatment, that we are there, that we can talk about it to them, to their partners, of course. Yes.
Sam, may I also ask you something? Maybe I didn't hear it, but is there postgraduate sexual medical education for doctors in Belgium?
It is a good question. You can have a MANAMA, a Master in Sexology, after any kind of master at the university, but that is a sexology master of 2 years. There is no postgraduate sexual course that you can follow at any university in Belgium. There are short workshops about cancer in urology care or in GYN care, but there is no global certification. That's what we're working on.
Yeah, thank you.
Thank you. Have a good day. Thank you.
So may I introduce the next speaker? This is Faisal El-Kak, and he comes from Lebanon, and he's working in the American University Hospital as a gynecologist, and he is in very important panels. For example, in a panel in the WHO called STAGE, and we are looking forward to what he has to say. Thank you.
Thank you very much, and again, thank you, Marianne, for inviting me to the whole network meeting and also to this specific group. We at the American University of Beirut Medical Center, I founded and the director of what we call the WISH program, which is the Women Integrated Sexual Health Program. It is the first program in the whole MENA region that within an academic center that provides clinical services, research, and really excellent social platform advocacy for women and men. We also, within the WISH program, started something, the Oncosexology initiative. We have around 2,000 cancer patients per month. So far, we have done training for the nurses, and we have done some orientation for the oncology attendings, knowing that our numbers in terms of knowledge are much lower than Belgium. Yeah. It's like probably 10% of the oncologists will talk to the women and men about their sexual function and expectations before and after. So we started this first phase, which is the training phase. At least now the nurses know how to address the topic, how to initiate the questions with the patients, and go for the EPIC, because it's an electronic record, and also for the doctors. We're having our first what we call training meeting in October for around 30 to 45 oncologists that will cover Lebanon, Jordan, Iraq, and probably Egypt. And this will be the first group that will promise or pledge to start talking to their patients before and after the treatment. And of course, we look forward to be collaborating with the group and with the network and have some expert exchange and have people probably coming over to Beirut for presentation. I think this is very important, and there is willingness to do that. We have the resources. There are a lot of global resources available. I don't know if the network is going to produce any or generate any resources for the training. But already over the past 3 years, we have been giving random lectures, like a session in a meeting, 2 sessions in a meeting, attended also by physicians, urologists, gynecologists, and family physicians from the MENA region. Hopefully, it will be the first initiative in the region that looks at sexual function and sexual health in cancer survivors. Thank you.
Thank you very much.
We don't have a microphone, so I will need to repeat the question.
And you need to put the
Can I
microphone.
speak from here?
Yes, I just wanted to tell you, we spoke about it already. We spoke about it already, that the Austrian Academy for Sexual Medicine has now already free onco-sexological webinars, and you are very much welcome, and the whole group, I will welcome the whole group, to first of all, to be part of the speakers maybe, but also especially to be part of the listeners, and so we can speak about that. I think that would be also your colleagues in, and it's without paying anything, because we are getting a medical educational grant, and we applied for that, and the chances are excellent that we get it, so very much welcome.
Thank you very much. And also I will thank you again, and I will make use of this opportunity to probably try to hold a meeting with you in the coming next week, and with the oncologist in charge, who is also a very international expert oncologist, and to have some form, if you want, of a memorandum of understanding or agreement on being a partner to lead with us on this, not only in Lebanon but also for the region. There is a lot of need,
I can imagine.
and readiness to really try to build up resources and skills on that topic.
I can imagine. I think that will be a very constructive cooperation.
Yeah, we look forward to that.
Are there any other questions to Faisal? So thank you very much.
Thank you very much.
Thank you very much.
And anybody has any idea for later on or any contribution, also welcome. Thank you.
I just wonder,
Okay.
question, how the pelvic physiotherapy care in your countries, the region,
That's a
how's
good-
that?
Very good question. The question is about the pelvic therapy care. We understand very well that pelvic therapy is a major interventional treatment in these cases, not only in the case of cancer survival, but also in the cases of genital pain and others. We had 2. One of them we sent to Boston. She did her master's. She came back and then she went back to Boston. So currently, I think we have only 1 person, but they are spread out between physiotherapy, the usual, and other things. So we don't have a specialized, focused physiotherapist in that regard, pelvic therapist. Probably you can come and visit us.
Or work. I don't have another job.
Yeah, that's important. Or send somebody to Marianne to train pelvic therapy.
Yeah.
Thank you.
Thank you, Faisal. So, the next speaker is Marie-Louisa Hanska from Uruguay. Marie-Louisa, are you online?
No, she's not here. Maria Luisa is online. Ask her now.
Maria Luisa, are you online?
She is online.
Yes, I am here.
Okay, so Maria Luisa, first of all, you are very much welcome to speak about the situation of oncosexuality in Uruguay. And may I ask you to introduce yourself, as I do not have enough information. Please.
Yeah, please, if you can close the other presentation. Thanks.
I have Mac. In the Mac is another way how this you or another one have this computer because the Mac is another.
But where is that presentation? Do you have that presentation there?
It's in the folder presentations. Yeah, don't click on it.
No, it's not here. This is our old one. It's our old one.
We just
Do you
don't
have a presentation to share?
Yes,
with
of course, but
me? Yeah. Can you share it, please?
But then you have
Yes,
to click the
but-
other right.
no, because the other is open.
Stop share.
No, it's not open anymore. So,
Now, yes, maybe yes. Yeah,
Can you share the screen?
okay.
She is to be given the right to share. Okay, she got it.
Now, yes.
super.
Yeah, it's perfect.
Okay.
Thank you very much.
Okay, okay. Well, I am Maria Luisa Banfi. I am gynecologist and the fellow of the European Committee of Sexual Medicine. I am from Uruguay. Okay, Uruguay is in South America, and we are here. Here, okay. Uruguay is a small country, and we are only 3.5 million inhabitants, and Spanish is spoken. Sexual medicine, a long road and hard road work for us. Achievements. Uruguayan Society for Sexual Medicine was founded in 2001. The Diploma of Sexual Medicine, and we have got it in 2017. 2 generations of sexual medicine specialists till 2022 with certified education from our university, our Republic University, from our medicine faculty, and from our health ministry. About care, 40 doctors working in polyclinics of general hospitals and or in private practice, living in almost each of the department provinces. We have 19 of the country. Through the networks and other means, we communicate periodically of this new specialty and where they are working. About education, sexual medicine in Uruguay was born recently, as I have said. Sex education is not included in the medical career. In the diploma program in sexual medicine, oncology is included, of course. In the postgraduate of oncology, sexuality is not included. In the program we have scheduled for this year from the Uruguayan Society for Sexual Medicine, we will hold a webinar for oncologists and other for the different specialties. Our book of reference, our first book of reference, is that written by Jacob Reisman and Jan Otten about cancer, intimacy, and sexuality. About information, well, we have found during these 10 years only places about information. For example, from Psycho-Oncology, a magazine, a paper about health-related quality of life as a complex, multidimensional construct that may be affected by demographic, medical, and psychosocial variables. And medical magazines to practitioners, a paper about breast cancer and sexuality. An oncology magazine from an oncologist and for oncologists about sexuality in cancer patients, importance of your assessment. We have a book for gynecologists, and we have written a chapter there about integrating the sexual narrative to the oncological clinical history and building therapeutic tools for the achievement of a better quality of life. Well, what's happening? Oh. Yeah. No, here. About research. Well, we have found some papers. I am going to tell you about the titles, the topics. Breast cancer, more than just a medical problem. Written by a social worker and an anthropologist. Well, another one about psychological variables associated with health-related quality of life in women with breast cancer post-surgery, a systematic review. Another one in modality of monograph about breast cancer, mastectomy, and sexuality. One more about psychological aspects that are mobilized in the diagnosis and treatment of testicular cancer. Well, what's happening here? And the last ones, prevalence of sexual dysfunction in gynecology, oncology, excluding breast cancer. One more modality monograph, the sexuality of women and breast cancer. Assessment of the sexual health of breast cancer survivors and their interest in discussing their difficulties with their doctors during follow-up. From an oncology service and Department of Medical Psychology in School of Medicine at Ina Hospital. And the last one, modality monograph, a psychological look at the impact of mastectomy on the body image of women with breast cancer. Conclusions. 12 papers were reviewed. In all of them, sexuality was evaluated. In Uruguay, the first cause of oncological morbidity and mortality in women is breast cancer, and in men it is prostate cancer. Most of the referred works are related to breast cancer. One with gynecological cancers, one refers to testicular cancer. no one about prostate cancer and sexuality. One of them refers to the need for evaluation of sexuality in patients with cancers in general. Another addresses the sexual narrative in the oncological clinical history and therapeutic tools for the achievement of a better quality of life. In 2 studies, it is highlighted that the highest percentage of women wanted to have medical attention for their sexual dysfunction, but it was not the expected. Among the authors, most are psychologists, 2 general practitioners, a gynecologist, an oncologist, and a social worker. 5 had sexological training. 2 were males, no one urologist. I have to thank to the Austrian Academy for Sexual Medicine for the invitation to participate in this event. I have to thank to Dr. Jorge Locatelli, an Uruguayan, who carried out the bibliographic review of the works presented. Thanks to all the participants for the list. Thanks.
We have a question. But Faisal, can you go on to the front? She don't hear this microphone.
I am listening too badly.
Thank you, Maria. Do you hear me well now?
Yeah.
Do you have an idea or do you remember the average age of the breast cancer survivors? What is their age? And
Yes.
Yeah.
Yes. We have a good number of survivors. You are telling me about the age?
Yes, their age. They were like average age, 45, 50.
40.
40. And they came by their own, or they have been told before the treatment that there will be some sexual health counseling and treatment?
No, nothing at all about to tell them that there is a place or there is a polyclinic or a place to talk about sexuality. If they know that in the hospital they are treating them, there is a polyclinic about sexual medicine, now they are going to those places.
Okay, last question. Do you have a feedback from the women that they were satisfied with the treatment or with the intervention or with the counseling, or not yet?
Not me.
Okay.
Not me.
Thank you.
Thank you to you.
I also have a question, and thank you for your pioneering. And it's always difficult to be a pioneer in a small place. Yeah. Yeah.
In the south,
yes.
it's everything difficult.
Yes, but even though you are in a small country, you have a large continent around you. So do you have any collaboration with the surrounding Latin America?
Yes, we are trying. We are trying. Yeah, we work with the slums, the American Society for Sexual Medicine. So we are trying. We are trying.
I have a question also, and pardon me for being very Scandinavian and very blunt, but how come that you from a Latin American country do you think that there's so little interest for the male sexological dysfunction after cancer treatment? I was surprised that it's you take the burden of doing the research as gynecologist.
No.
So let's shame the urologist now.
It's very simple. For me, it's very simple. Because as a gynecologist, you receive the women And when you have empathy in the consultation, you talk with women, and women bring us their sexual problems, the problem of the husbands, the partners, and the problem of their children. So, yeah, if you have empathy for women and for families and for people, well, you are always talking about, you are always making questions about quality of life. And sexuality is one of them. We are here we are here, we were born by what? A sexuality act. So that's the first thing to talk.
Yes. Thank you. I don't know, any other questions from the audience? I don't think so. So thank you for a wonderful presentation, and keep up the good work. We gynecologists must stand together. Yeah.
Okay, thank you very much.
Sorry. Gunther.
I will be very short.
I think we will wrap up the session now with Jutta. Yeah.
Yeah. Are good thanks. First of all, thank you very much for inviting me to this session. I was very surprised when I received this invitation, because I was like thinking, where the wind blows from. And then I tried to clarify, and it seems like everybody thinks that in Latvia everything's more or less okay. And then I said, okay, but the topic is very interesting. I know that I already expressed my interest in this topic because in Latvia it's not really good things there. But I couldn't come here and say there's nothing in Latvia. So I tried to make some investigation and research. And what I really learned from this wonderful initiative, and thank you very much for that, that actually our student circle, and Cynthia may comment and come here, Cynthia, was those who started the dialogue on cancer and sexology, on sexual health in Latvia. These were students, and that's confirmed by medical professionals who work in the area of oncology. So Cynthia, could you please answer the question why? First of all, thank you very much for doing that. I know you were the head of scientific research circle of students, but why you chose that topic?
Yes, hello everyone. To be quite frank, a couple of years ago when I got elected as the chairperson of the sexology student interest group, one of my jobs was to prepare the plan for both theoretical and practical meetings for the rest of the year. I hosted more than 20 events covering different sexology topics. And one way that I prepared was I scrolled through old abstracts of European Society of Sexual Medicine conference abstracts, and that was the first time I encountered the term oncosexology. I had never heard before, and through email exchange with one oncogynecologist in Latvia, I realized that this topic has never been brought up. There's really not any research available, and therefore I initiated, at least my idea was to start with students and offer this as one of the research topics.
Thank you, Cynthia. And so far the topic has not been finished. And I have contacted that wonderful gynecologist, oncogynecologist, don't stand here, come here, that wonderful oncogynecologist, and he said there are 4 people who know how to mention sexual health in oncological, huge hospital with really, I will not tell how many thousands, but at the central hospital on oncology in Latvia. I communicated with men, gynecologists, not gynecologists, medical doctors that are dealing with oncological diseases for men. And they said, oh, the questions are there, but we don't know the answers. And then the last plea, and this is the plea. Dear Mariana, dear colleagues, we in Latvia, all those doctors I communicated for coming here to Ljubljana said, could you please ask somebody to come and to have an online course or to come to Riga for the course, because medical professionals working in the area of oncology desperately need this topic. Because women are asking, some doctors do understand that that's important. So that's my last sentence. Thank you.
Yeah. May I just, Gunther, thank you very much, and the sweet young lady, thank you very much for such a great initiative. I really admire this, and these are the young people we all need, and I would like to stay in contact with you and invite you also to our sociological webinars. Yes, they're really, really informative, and I would be very grateful if you would come. Maybe I just...
Thank you. We can go.
Yeah.
Thank you. I promise to be brief.
Yeah.
You were brief.
You were brief. You were very brief. It was very interesting. Hello.
Kept your promise.
So thank you all. I think it was a good start. Very good start. Very interesting. And we have to close now. And we will see us tomorrow at 9 o'clock. And there will be other presentations. And we will have enough time to speak about what we can do together and what could be our first steps to formate and strengthen our group. And I'm really looking forward to speak about that together with this whole group, and Astrid, of course, and Ilya. And so, all the best, and see you tomorrow, I think at 9, isn't it, Astrid?
Tomorrow
Yes.
at 9, yes.
Yeah, tomorrow at 9. Okay, so you are welcome to listen to the next presentations of our group. I will also speak about the ESMN network, and I will speak about the sustainability of the network, and you're very much welcome to listen to us, and there will be also a panel, and Anna Jani will speak about sexual medicine in general, so it should be very interesting. It would be great if you could stay after a short course, I think.
Yeah.
Okay, bye-bye.